I'm Lilian Duku. I come from Ghana. I work at KNUST, that's Kwame Nkrumah University of Science and Technology, and I am in the hematology department, teaching hematology and immunohematology. And I'm currently working on sickle cell patients, and it's more about blood transfusion in these patients. We realized that in Ghana, transfusing sickle cell patients came with so many troubles and challenges because patients were not screened for various antibodies that they are able to produce after receiving these blood transfusions. So they end up becoming alloimmunized, and it comes with so many complications.
At least 50% of the worldwide cases of sickle cell disease lie in West Africa. We need to do more partnerships but most importantly, partner with institutions in places where the burden is the most, and that is in a place like Ghana, where it's much more common.
So being able to do this work, I mean, it's informing the university community and the hospital as a whole that antigen matching has really improved alloimmunization, like has reduced alloimmunization rate. And since alloimmunization is linked to morbidity and mortality, it is also in effect going to reduce the rate of death among sickle cell patients. And carrying this sort of knowledge back to Ghana, it is also going to help us implement the antibody screening in Ghana, and also at a whole help us implement antigen typing as well. If we are able to do this, I think it is not only going to be beneficial to Ghana, but to the world as a whole. I presented the results that I had today at the blood bank, at the U of M blood bank this morning. And the staff, I mean the blood bank staff, they were motivated. I was like, wow, so what we are doing is actually helping to reduce alloimmunization rates. Then it's urged them to do more in trying to antigen match whenever they can to make sure that the patients receive. And they said, oh, we wish you come back in 10 years' time to do again, and we see that we further reduce the alloimmunization rate. So it also serves as a motivation for the people in here to see that what they are doing is, I mean, achieving better results.
And the other thing I want to say is we also set up a rotation for Lilian, so it wasn't just kind of blood bank, but I reached out to multiple people at the University of Michigan, the special coagulation lab, the the immunology lab, the general hematology, flow cytometry, and everyone, the hemoglobin, the HPLC lab, every one of them responded just wonderfully, and we set up a schedule that every month there was a special emphasis that Lilian would spend 2 or 3 weeks in that lab learning those skills. And also our sickle cell team enjoyed having her in our clinic, so she actually watched
sickle cell clinic every Wednesday.
Every Wednesday, so she observed how we treat sickle cell patients here in the U.S.
And patients who have received bone marrow transplants.
Yes.
Which I had not seen before.
Yes. It's the only curative option right now. So we've transplanted at least 8 to 9 patients who are living, and she's met a couple. So it was wonderful to see her. And that's something that has not happened yet in Ghana.
In Ghana, sickle cell patients do not live long. So it's like, it's the sickle cell that has killed the person, but sometimes it is as a result of us reacting to this transfusion. So first, we need to implement the antibody screening. And antibody screening doesn't require so much. The staff back in Ghana are well trained to be able to carry out these tests. If patients are not, if the condition is not managed, it could be fatal. But once they are managed or they visit the hospital, they are able to, ameliorate the condition. And transfusion is very important in helping reduce some of these complications.